Hi guys, it's Kelly. I am going to answer a few questions that you guys asked on my last vlog. I have an itch, sorry, you had to endure that. That's my hand here. It's in the soft cast. It's a semi-hard cast. And it has to be in this Lego thing to keep it elevated. I I had pain 2 years ago. Well, almost 2 years. It started on Labor Day. And it just came out of the blue. It was two of my wrists just started hurting me, and I went to so many doctors. Nobody gave me any answers to what the problem was. I had MRIs, CAT scan. I went to an orthopedist. I went to a rheumatoid arthritis doctor, chiropractor, um, general practitioner, my endocrinologist, so just a whole bunch of doctors, and some twice over. I ended up going to a rheumatoid arthritis doctor that suggested I go back to an orthopedist and get a second opinion. So when I went to the orthopedist, he gave me, he wanted me to do the, to do another MRI with the dye that's injected to it. I forget the name of it. But I did that, and it didn't show anything. The results came back, and he said the only thing I could do is I could do it. So I could do an exploratory surgery, and I could look in that way. And if there's anything there, that's the way I'd find it. And that and maybe that will solve your problems. So I was pretty desperate. So I said, okay, after school, I'll give you a call and I'll let you know if I want to go on with surgery. So after my school finished, I prayed about it because I ended up making the appointment, and this week I didn't know if I really should go. I was really nervous about it, so I prayed about it and I asked God. I said, if you think that this is the best hold on, I'm itchy again. I think it's the medication that's making me itchy. Most likely it is. But as I was saying, I asked God if He thought that I'm having a conversation. If He, if it was the right thing to do to have surgery, make my wrist hurt for the next few days. If it is not a good idea to have surgery, take my pain away for the next few days. And I was feeling fair then. I wasn't really hurting a lot. It just kind of hurt sometimes, and then it was okay at that time when I prayed. So the next few days, it was really bothering me, and I just took it as a sign, and I just said, you know what? I will never know otherwise if I don't do the surgery, and this is the time I can do the surgery because I'm out of work right now. So this is when I have to do it. So, and it is hurting now because I did ask for it to hurt. If you might think it's funny, but if God thought that I should get the surgery, it should hurt, and it did, and so I decided to do it. And He did say that there was tissue that needed to be removed, and it was inflamed tissue or something like that. I really didn't get the whole story because I was all loopy when He told me. My husband had gone to lunch and he couldn't speak to him because he was at lunch. So the nurses aren't really supposed to get into everything because they're not really supposed to, and the other nurse left too. So the techs, I should say, aren't supposed to get into everything. But the nurse left as well, so I was their last patient. So I just talked to him briefly, but I was loopy, like I said. And I said, do you think this is going to resolve it? And he said, yes. So I will talk to him on Wednesday again to make sure I heard everything right. And I'll fill you guys in. Alright? Take care. Bye. Hope I didn't ramble on too much. I'm a little drugged out here. And perks. So, have a good night. I'm probably going to go to sleep soon. It's early, but I'm kind of tired. So, take care. Bye.